Josh Nowicki here. A lot of exciting things happening with Camden County. I'm getting a lot of advanced stuff, which is pretty cool, with the cricothyrotomy kit and then the Bougie. I know a lot of people have never used Bougies before. I am a huge fan. So I told Chief Williams I'd make a video kind of explaining tips and tricks and give you the anatomy of the Bougie, how to use it, what it's used for, etc., etc., etc. So hopefully this is beneficial. If not, sorry. All right, so what is the Bougie? It is this. This is how it comes packaged. It's a blue, basic long hockey puck, or hockey stick rather. You have an adult and then you have a pediatric. So I think Chief Boyette ordered only the adult Bougies. I'm not sure if they're going to have the pediatric. So just to give you an idea of what their limitations are. So in my opinion, there's two types of people when it comes to a Bougie. Opinion. You have the type of people who love them, and then you have the type of people who haven't used them before, because they're pretty great. For us here at LifeFlight, it's significantly increased our overall intubation success rate. And it's also but you have to train and you have to learn how to do it so you can anticipate the woes and, the bad stuff that could happen when you do use it, or anticipate, the negativities with it. So that's what we're going to do. All right, so ET tube, right? This is a 7.0 ET tube. When we intubate, typically people will leave the ET tube like this, or they might put a little hockey puck in there at the end of it to make it advance easier. But the limitations that you run in with a regular ET tube with a normal stylet is that this is not very flexible. Not only is it not flexible, but it also, you can't manipulate it very well. It's kind of, once you have that shape or that mold, you're stuck there. So a lot of times what will happen is you'll pass the tube, and let's say you're not in a straight line, you'll pass the tube and you'll try to get past it, and then it'll just bend and bend and bend. And then now you're stuck with it bent like this. You got to pull it out and straighten it up. Well, with the Bougie, that's not really an issue. So what the Bougie does is, ideally when they come packaged straight like this. When you put them in an airway roll, like this is our airway roll, and when you put them in the airway roll, just because of how it is, they bend up like this, and then they kind of mold to that formation. But to use them in the most beneficial way, you really want them to be straight. What I would do on the ambulance, because inevitably you have to put it in the airway bag or roll or box, and that's fine. You can try to have them as straight as possible, but ideally what I would do is I would put one in the box, one in the airway roll, whatnot, and then I would put them also flat on the shelf where the BVMs are in the ambulance. That way you know for a fact that you'll have a straight one. So if you ever go to intubate somebody, whatever situation it is, you'll know that you'll have a straight one. Whenever I go to scene flights and I land and I go in the back of the ambulance, I always look to see if they have one in the ambulance for me, because I know that it will be straight. So anyways, so what is the Bougie? So this one, it's 70 centimeters long and it's a 15 French. What does that mean? It just means it's a big long stick. So at the end of it, you have a straight end, and then you have an end where there's a little hockey stick. This is called a coude tip. Originally, when they created the Bougies, they were supposed to be blind insertion devices. So you would basically have a missed airway attempt or whatnot, and then you are going to a backup airway prior to putting a king in. And then these were designed to where you would insert it in blindly, and then it would go past the vocal cords, and then it would basically be, you could feel the ridges as it goes into the, or passes through the cricothyroid rings. So you should be able to feel that. However, in my experience, I felt it one time, so I wouldn't really take it to the bank. And I think they stopped calling them blind insertion devices years ago, because these things came out probably, like 13, 14 years ago. So what we use them for is actual Bougies, or I'm not Bougies, but actual stylets. So there's one of two ways that you can do it. You can do it just like this, where it's not preloaded, or you can preload it. And I'll show you guys both techniques and why it's beneficial. So unfortunately, I'm doing this on my phone, so I'm gonna have to move the camera around a little bit, and I have a video laryngoscope where I can show you actually what happens. So what's the benefit of this thing? So it's very pliable and you can manipulate it. So when you are going to put it in, say you're intubating and you're going to put it in, what I do is I put my thumb on the end and then I run it through and put 2 fingers on top, 2 fingers on the bottom. So what happens is if I do go in and let's say I'm in and I'm not exactly lined up with the vocal cords and I need to manipulate the tube or manipulate the bougie to try to get it into the vocal cords. What I'll do now is I'll push down and then now the bougie will go up. So you go in, and then you push down, and then now you can get it past the vocal cords. So you can manipulate it, right? And then what you would do after that point is that you would basically just pass the ET tube over top of the bougie. Okay. You can also preload it. Now preloading it has a huge benefit in that it's already there. It's less hands, less moving parts. So to preload it, what you would do is this is one that's already been preloaded for a long time. But so you see you have that coude tip. That's obviously going to the patient. So what you would do is you would always want that to be going up. So you would put it in through the ET tube. Now this is very, very, very important. You put it through the ET tube. You take the bag valve mask end, and then you would send it through the tip or the bevel of the ET tube. So now it's like that. But you don't want to leave it like this because now you only have this much room to work with. Okay. So now what you want to do is you want to take where the coude tip is and you want to pull it to where now your BVM adapter is all the way at the end. So now it's just preloaded. I think, I forget what they call this thing. The Kiwi. They call this the Kiwi method. So now what you can do is you can still manipulate it the way you would do it when it's not preloaded, and then you have the ET tube already on there. So when you get into the airway, now what you would do is you would just take this part right here and you would empty that out, and then you would pass the tube. Okay. So personally, I'm not a big fan of this just because I like to have the bougie there by itself. So I can kind of like move it around, and if I'm going in and I have to go sideways or I have to go like this, I'm not worried about the ET tube hit me in the face or anything like that. But a lot of people do like it like this because it does have its benefits. So that's how you preload that. So without it preloaded, I'll show you a little technique. What I do is, so I have without it preloaded, you need an ET tube that does not have a stylet in it, obviously. So when you go in, so we have the laryngoscope, you would go in, you pass it past the cords, and then now you would take it with your left hand with the laryngoscope still in, grab it with your left hand, bend it around like this, and then it makes it easy for you to feed it over the ET tube and then back in. And it's a one person process. But we always work as a team, so you always have somebody there. So if you didn't want to do that, you could just pass it in, and then you could just get somebody to feed it over top. It's up to you, however you do it. Me, I have control issues, so I kind of like to do it myself. But when you do that, you have to make sure you hold on to the bougie. All right, cool. All right, if you are going to preload it and you do not kiwi it, it's not really recommended, because the problem that you run into is that if it's just like this and you're passing it, or you're hitting resistance, or you're holding onto the ET tube and you're trying to bend it, inevitably you could hit a thing and you could like say you would hit around the retinoids, or you would hit around the cords, and then you wouldn't be able to advance it. So you want to make sure that this thing is stabilized and in place. Cool. So the adult bougie, I'm pretty sure it goes down to a 7 or 6.0 ET tube, just the diameter of the actual bougie. I don't think it goes over top, lower than that. But for us, adults is a 7.0 is the smallest that we're going to use, because that's our smallest cuff tube. So typically you're not going to have anything smaller than a 7.0 that's going to go on the adult bougie. And then for the pediatric bougie, if we do order them, the pediatric bougie will go, the smallest is a 4.0 ET tube. So if you have that patient who you're really have a little high level anxiety with, and it's an infant or something like that, where you're going to put in a smaller ET tube like a 3.0 or 3.5, just know that the pediatric bougie won't work. So if you do go to use that, and then now you go to pass the tube over the bougie, then it just won't fit. Also, a benefit of the bougie is it's a tube exchanger. So if you ever have an instance where you intubate the patient, you get the ET tube passed, you try to inflate the bulb and it doesn't inflate, so you know the bulb is bad, but you know that you have a good tube, you could just stick the bougie down through the tube again. Now it's in the airway, and then you can pull it out and then re-intubate with the a better ET tube that has the a good bulb. Yeah, okay, cool. So what I'm gonna do is I'm kind of gonna show you guys on an airway head. So if you give me a second, bear with me, I have to move this camera around and set it up so you can see it and it's hands-free. Got my little box right here. Switch cameras. Nope. All right, cool. All right, so there's the airway head, and like I said, I have a video laryngoscope so you can see what's actually going on in the airway. All right, so obviously this is cheating because it is a video laryngoscope. All right, so there's the epiglottis. We have the vocal cords right there and the retinoids down there. So what would happen is if you do the bougie by itself, you would go in and see how right here I'm going low and I can't really get it up past. That's where you would manipulate it, and then you can kind of guide it on in wherever you need it to go, right? So now it's in. So because I'm by myself, I'm gonna grab it with my left hand, I'm gonna bring it around, and then I'm gonna feed the ET tube over top of it. Okay, so this is a common problem that you'll see is, you see this bevel right here. This bevel can hit the vocal cords, and when it hits the vocal cords, it can stop. And so what you want to do is you want to make sure that this bevel stops hitting the vocal cords. So what you would do is you would go left. If that happens, you would go left like this, and then you would pass it through the vocal cords. Cool? All right. So now that's in there, and then you would inflate, obviously, take out the bougie, et cetera, et cetera. So let's say this is a patient who is intubated, and we realize that the cuff is leaking and we don't have a good air seal, or let's say we're ventilating them and you see bubbles coming out of their mouth, which is indicative of not having a good air seal. So you want to swap the tube out. So again, what you would do here, personally, I never swap the tube out without putting in a laryngoscope, because things could go wrong. So I would put the blade in, or laryngoscope in. Make sure you get good visualization, however you get sorry about that. Make sure you get good visualization, however you would. And then I would take the bougie, and this one, it's less important that you use the coude tip first. So for that one, I would actually take the other end, send it through, and then now deflate, and then you would pull the ET tube out while maintaining the bougie down there. So then as soon as it pops out, now you would grab the bougie so you don't actually pull it out, right? And then so it's in there, and then you would take the other ET tube that you want, and you would feed it over that, and then you would feed it over, and then you would send it in. Yep, and then there we go. Cool. All right, let's do it preloaded. So let's say we have a bougie that we're preloading. Okay, so again, to preload it, you're going to send the bougie through where the coude tip's on the top. Okay, and then you're going to put that through the Murphy's eye right there, and then now we have it preloaded, and then you're going to pull it down like this, so we have all this. So now I can manipulate this. So now I'm going to go in, get a good look at the cords, which I got right there, and then now pass it through the cords just like that. Try to bury it. I'm going to disconnect here with my thumb. It's disconnected. Now my tube's already on there, and I can go in, just like that. Cool. All right. Inflate, pull the bougie out. Now I have a good airway. All right. So like I said, there's a bunch of benefits when it comes to the bougie, and there's some negativities with it. One could be the biggest negative when it comes to a bougie is that whenever you have it in your airway roll and it's wrapped up like that. If that happens, I try to straighten it out as much as I can, try to get it as straight as I can, and then you can see it it does it like that. And then you can just use it all in there. So when you get these at the station, I would make sure that you definitely practice, kind of feel what's comfortable for you. If anybody has any questions about the bougie or wants to talk about, well, has this gone wrong, or what if have you ever tried this, or kind of want some pointers with it, please by all means call me, text me, throw up a smoke signal, whatever, and I'll try to answer as best I can. All right, thanks.